Now, papillary dysfunction and rupture. Let's give a quick review of these conditions. Papillary muscle dysfunction is a very common problem in ischemic heart disease, mainly when it involves walls with papillary muscles. In these conditions, in case of dyskinesia of these regions, the papillary muscle will be stretched outward, since the wall is stretched because of ischemia in these walls. Since the cardia remains with the same size, the mitral leaflet will be pulled apically. Usually the valve may present an aspect of a tent and may have mild to severe mitral regurgitation. So, there may be papillary muscle dysfunction in acute or old myocardial infarction, or even without infarct, just with all motion abnormalities in ischemia. In this case, the posterolateral wall as well as the papillary muscles are fibrotic, but this is not necessary to produce mitral regurgitation. They may be just ischemic. Papillary muscle rupture is a much more drastic happening. You may even see some normal-sized left cavities because of the acute origin of the regurgitation. The patient may be in shock. Similar to rupture cardia, you'll find papillary muscle head inside the left atrium during systole. In this case here, we can see a partial rupture of the papillary muscle. See this transesophageal echo transgastric view, where this papillary muscle is almost loosened.